about BHT and Metaneb therapy. So the first thing we're going to do is check a patient's chart, make sure there's no contraindications to do this therapy. Those would include untreated pneumothorax, hemoptysis, ICP greater than 15, any facial trauma, hemodynamic instability, nausea, things like that. The patient does not have to be alert and oriented to do this therapy. We do need, we can use it on a vented patient, and we have different options to deliver this. So the Metaneb, what it does, let me explain first. It's a 3 therapy in 1. It does aerosol delivery, it also does lung expansion, and then airway clearance. So it's very versatile on how we can use this. So we'll also check the patient's chart to see what kind of medications, because it does aerosol delivery, what kind of medications we can bring in prior to doing this therapy. We can grab the Metaneb if it's not already in the patient's room, and a circuit adapter here if it's not already in the patient's room as well. So we'll go ahead, enter the patient's room, introduce herself. Hi, my name's Kate, I'm with Respiratory. Today we have you to do some Metaneb therapy. So I'll explain to the patient that that's going to help with the secretions, the excessive secretions that they have, that we're going to go ahead and try to get it. It'll help them cough and cough it out. Also, it'll deliver some medication, some aerosol medication that we have for them, and help open up and treat and prevent the atelectasis, open up those airways, lung expansion. So today we're going to use the mouthpiece. It's really important for the patient to keep an airtight seal around their mouth. We can use a nose clip if they're having a hard time breathing through their mouth and want to breathe through their nose. And if they're really having a hard time, we can use an anesthesia mask and just hook that onto them, and then they don't really have a choice to breathe through their mouth or nose, or take breaks, because it'll be around or completely secured around their nose and mouth. If they're a vented patient, there's a hookup here. We can go ahead and unclick this blue part and hook it up to a vented patient and do the therapy that way. Throughout the therapy, it's really important to monitor our patients and to be coaching our patients. We're going to be monitoring their vitals, most importantly their respiratory rate. It's really easy to hyperventilate during this therapy, so that's really important to watch. And then also watching their effort throughout it. We want to push our patients, but also we don't want to push them too far where they are going to hyperventilate and cause more problems. So we'll explain to the patient as well that the procedure or the therapy will be about 10 minutes long, and we'll need them to be pushing themselves throughout the therapy. And just breathe normal throughout the whole therapy. So now that they've got an airtight seal around their mouth, I instruct the patient to put that in their mouth, and we're going to hook the circuit up to the device. If we didn't already put in our any medications that we need to give them at the time, then we can just put saline in there. It's very drying throughout this process, so the saline definitely will help with that. So we'll go ahead, there's a little hole, we'll insert it, it's kind of cocked sideways, and then you click it down into place. The circuit's in there. Mouthpiece is in their mouth, and we will start them off. The on-off switch is up top here. Click it on, lowest flow setting, and we'll start them off at the aerosol delivery point. This is the manometer that we'll be watching the whole time. We want the patient to be between 10 and 20 centimeters of water pressure. And if they're not reaching that with their while they're breathing, we can increase the flow and make sure their pressures are getting up there. That's going to help with that lung expansion. It's really important to have it at a therapeutic range. If their pressures are too low, we're not doing anything. The therapy is kind of being pointless. So 2.5 minutes of aerosol delivery. We'll kick them up to the continuous high flow oscillatory next for 2.5 minutes, and this is where they're really going to start to work. You'll see their cheeks puff out. They have that good airtight seal. We can switch the rate of the oscillation, also increase or decrease the flow as needed. And we're instructing our patients to breathe against, and also allow the air to push down into their lungs. You'll see some vibrations. We'll want to see, this is the airway clearance part, so we'll want to see them actively working and pushing them there. Then after 2.5 minutes of that, that, we'll go ahead and click them back down to the aerosol delivery, give them a little bit of a break, and then click them down to the continuous positive expiratory pressure. This is like the easy PAP portion. So we'll go ahead, this is going to, we'll want to instruct our patient to allow that positive expiratory pressure to allow them to let it in and let them fill up their lungs and while they're exhaling, and just keep that tight seal the whole time throughout the therapy. Again, watching their pressures, watching our patient for any indications of hyperventilation, lightheaded, dizzy, nausea, things like that. If they do, go ahead and stop the therapy, give them a little bit of a break throughout it. We can manipulate different times and things with this, so it's just really important to monitor our patient. We'll listen to our patient's airways afterwards. We're looking for a decrease in work of breathing, also the lung sounds to have diminished, and any crackles and things like that, lung sounds to diminish, and make sure our patient is comfortable. Their work of breathing should have decreased after this therapy, and we're looking to see if we got any airway clearance, if their expectorant